Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Sutini, and I'm from Semarang State University. The topic of the presentation about socio-demographic characteristics associated with loss to follow-up antiretroviral therapy among HIV and AIDS people in Semarang, Central Java, by case control study. Sorry. My online presentation is the first is introduction, method, result, and conclusion. Number one, introduction is HIV and AIDS. More cases the words are increasing global, also in Indonesia, especially in Semarang City and Central Java. The impact of HIV and AIDS is morbidity and mortality related age. HIV treatment is with ARV, antiretroviral therapy. ARV must be consumed for people living with HIV and AIDS for a long time. ARV therapy has significantly reduced mortality and morbidity related age. And treatment ARV as prevention studies demonstrate effectiveness of ARV in preventing new HIV infection. And then ARV is very important for patient HIV. Plus to follow up, ARV has a great negative impact on the immunological benefit of ARV. Loss to follow-up in Semarang is 21%. This is overperformed where target is loss to follow-up is under 20%. Sorry, loss to follow-up defined as not taking refill for 3 months or longer from the last attendance for refill and not yet classified as death or transfer out. Method design of the study was observational with case control study. The population was HIV and AIDS patients who are recorded in HIV care. Support and treatment in services at primary health center and hospital and in Semarang. Patients who did not take antiretroviral for 3 months were defined as loss to follow-up. There is 67 patients. While those regularly take ARV for 3 months become a control, there is 67 patients. By purposive sampling technique, independent variable are age, sex, marital status, level of education, employment status, distance from the health facility. The dependent variable of the study was HIV and AIDS patients who are lost to follow-up ARG. Data collection was carried out by interviewing using structured questionnaire. Uniform analysis was carried out to describe baseline socio-demographic characteristics. Square tests were used to measure the significance of differences in socio-demographic characteristics. Multivariate analysis using a logistic regression was performed to identify factors associated with loss to follow-up. The criteria for selection of variable possible for inclusion in analysis were based on p-value less than 5%. The strength association was measured using mass of ratio. What ratio is result is the study p-value analysis. This is a low education applied distance from health and facility has significant association with loss to follow-up ARV among people living HIV and AIDS in Semarang City because p-value of less than 5%. And the result of the multivariate analysis showed the low education 6 times the odds of being lost to follow-up compared to high education. And conclusion of the study in people living with HIV in Semarang who has low education are the major significant factor for loss to follow-up to RT treatment in Semarang, Central Java. Our recommendation focusing on counseling and education about RT will help increasing knowledge and awareness for each HIV patient in adhering ARV and taking medication according to the doctor instruction. Okay, thank you. Thank you so much for attention. Wassalamualaikum warahmatullahi wabarakatuh.